Welcome everyone to today's webinar. My name is Caitlin Karolenko. I'm Scientific Program Manager at the Institute for the Advancement of Food and Nutrition Sciences, or IFANS. Today we're on part 2 of our webinar series with RTI International that is well suited to anyone interested in learning more about consumers and how they interact with nutrition and food safety information. In part 2 of today's webinar, we're going to be discussing consumer perceptions, approaches to understanding these perceptions, including case studies that will illustrate methods for measuring perceptions. So a little about us. If you're unfamiliar with IFANS as an organization, we are a nonprofit organization focused on advancing food and nutrition science. We are guided by our core values, which are scientific integrity centered on transparency, collaboration, and public benefit. This is done by bringing together our members from government, industry, and academia to identify areas of common interest and develop projects to advance science in those areas. As an organization, IFANS funds research and convenes experts to deliver a variety of products to include competitively funded research, workshops, dialogues, and peer-reviewed publications. Quick little logistics note before we get into today's webinar. If you do want to ask a question, go ahead and click on that Q&A tab at the bottom of your Zoom webinar screen. Just a quick note, the chat has been disabled, so the only opportunity for you to ask questions is within that Q&A tab. The questions are only visible to IFANS staff, and we'll have a chance to address those questions at the end of the webinar. So with that, I am pleased to introduce Dr. Brian Southwell, who's a distinguished fellow at RTI International, where he oversees research to assess risk perceptions, mental models of scientific concepts, and public trust in science and scientists. Dr. Southwell is also an adjunct professor of the internal medicine with Duke University, an adjunct associate professor with UNC Chapel Hill School of Global Public Health, and an adjunct faculty member with the University of Delaware. Dr. Southwell also has served on several National Academy of Science and Engineering and Medicine committees, including the Standing Committee for Advancing Science Communication. Dr. Southwell is going to kick us off with some brief comments and then introduce our speakers. So with that, Dr. Southwell, the floor is yours.
Great, thank you much, Caitlin. I really appreciate the chance to be here, and we really appreciate the chance to continue with this seminar series. We had a great set of conversations last time with a couple of colleagues, Sherry Cates and Dallas Wood. And today we get the chance to continue the conversation and to focus on some different aspects of work that we've done at RTI over the last couple of decades, really. RTI International is an independent nonprofit research institute, which is headquartered in North Carolina, but we also have folks working all over the world. And we've been doing a lot of work, social science research that's particularly relevant, I think, to hopefully much of the work that folks in the audience are doing. Today is the second in a series here, but before I get started to introduce that, I want to offer just a disclosure here. So if we want to move to the next slide, and I'll do that. So with each of these sessions, we do want to make sure that you're aware of the work that we're talking about. Today, the main disclosure we have to offer is just that the projects you're going to hear about were funded by the U.S. Food and Drug Administration. We've been doing a lot of work, in the last couple of decades for FDA. You're going to hear about some of that today, specifically as it relates to consumer responses to risk and benefit information. It's really been wide-ranging and an interesting set of projects that we've done in conjunction with former colleagues at FDA. So if we move to the next slide, I will introduce the two main stars of the show today, Bridget Kelly and Mickey or Mihaela Johnson. Both are colleagues of mine at RTI International who are, I'm willing to say, are exceptionally sharp and are folks that I always appreciate to be in a meeting with. And we're going to give us an overview of really interesting work that's happened here in recent years. We're first going to hear from Bridget. Then we'll hear from Mickey after that. But before we move to the main part of the talk, if you want to move to the next slide, I'll just offer a little bit of an additional description for folks who might not have joined us the first time about this overall series. So in part 1, and you're able to find that video now, you can hear about innovations in consumer perception and behavior measurement specifically. Today, we're going to move ahead to talk about engagement with risk and benefit information specifically, both in terms of cutting edge measurement techniques and different ways we've been able to analyze that data in experimental settings, in larger survey settings, and we've tried to make sense of that to understand what we may learn about consumer engagement with risk and benefit information. Next time, in part 3, which we have coming up here at the end of October, you're going to hear from a few additional colleagues of mine, in which we're going to talk about the fact that there is a wide and complex information environment that many consumers have to navigate. And it also turns out we've been involved in work to both track and monitor that environment, and to help make sense of and to look at efforts where different groups and organizations have tried to help consumers navigate and make sense of that conflicting, sometimes complex, and sometimes inaccurate information that's out there. So with that, I'm going to turn the floor over to Dr. Kelly. Bridget, the floor is yours.
Thank you, Brian. So the idea that health claims on food products are ubiquitous in our environment is probably nothing new to this audience. But as you may have noticed, this year there's been just a lot of news and discussion about potential claims that could be added to packaging in the future, including things like healthy, ultra-processed, natural colors or dyes, and clean labels. And so in that context, we wanted to talk a little bit about why it's important to understand how consumers understand these types of claims, and how we might measure those perceptions of such claims. So in today's webinar, we're going to discuss the importance of perceptions and the challenges in measuring them. And then we're going to show you some example research questions and different approaches that could be taken to answer those types of questions. And then lastly, we will show you some example case studies that demonstrate the types of methods that we have used in the past to answer similar questions. So I will give you one caveat that the case studies we're going to describe today were all conducted in the context of prescription drug advertising, but I think it will be really easy for you to see how these methods could very easily be applied to other contexts, including food and nutrition types of studies. So why are we measuring perceptions? Before we get to examples, I want to talk a little bit about, why is this important? Well, people think of a product, what people think of a product is important because it often drives their intentions to purchase said product. And there are obvious reasons that we would want to know about what people might be intending towards particular products, what they're likely to buy, and what drives those intentions, other than the obvious things like taste, preference, and price, obviously. So if we want to promote healthy choices or intervene on unhealthy ones, we need to know what types of claims that might appear on product labels can affect them. Now, this isn't as easy as it might sound. There are some important challenges that we want to mention that need to be considered in thinking about how we would go about designing studies to investigate perceptions. And one that is obviously apparent in most types of observational research is social desirability. So, just asking people how much they like a product, that's not going to necessarily be so valid. Sometimes consumers have a tendency to tell researchers what they think they want to hear. We also might run into issues with a very complex construct, which might be multidimensional. So for example, if you want to know about the benefit perceptions of a product, what elements of that construct are we looking to measure? So are we interested in how likely the product is to have that benefit? Are we interested in how powerful or strong the benefit might be? Are we interested in how long the benefit is likely to last? So as you can see, there are a lot of different dimensions to just one particular perception construct that we might be interested in. And then also, obviously, perceptions can change rapidly based on the information environment. If someone is seeing a lot of social media posts about a particular product or a type of food or an ingredient, their attitudes and perceptions may be very likely to be influenced by some of that information, or news reports, other types of information. And, often we do expect that there would be cross-cultural variability, which would speak to the importance of considering who exactly is the audience and are there different audience segments that you might want to include in the research. Okay, so we're going to move on to talking a little bit about the different types of labels, cues on products that might influence perceptions about that product. And I mentioned already, obvious things that affect perceptions would be taste, price, and a person's previous experience with that food or product. But there are things about the package itself and the information available about the product that are obviously also really influential, including the product's name itself, if it has the words healthy or all natural or sugar-free or something along those lines embedded in the name, the label, and then things like the disclosures or disclaimers that might be available on a project. Think product contains egg, or consuming undercooked shellfish can result in illness, those types of claims and disclosures that can be included on packaging. These all can have important influence on perceptions about the product. So as we are considering how we would want to measure or understand those perceptions, we need to factor in all of those different pieces that I've talked about prior, and then also things like the nature of the research question, the dimension of the perception, and that's when I mentioned already the different elements that might factor into the specific construct. The level of analysis. Are we interested in what individuals think, or are we interested in knowing how prevalent a particular thought might be? So more of an aggregate level of information. What the general sentiment is about something online. And then feasibility and context. So what we mean by feasibility is it might be great to go into a grocery store and see, are people reading the display about a product? And if they are they likely to purchase that product? But how feasible would it be to actually do the study in the grocery store? And, where and how many stores and things like that would you be wanting to look at? So that's obviously going to be a factor in deciding about your research approach. So now I'm going to turn over to Mickey, who's going to talk about some example research questions and some of the different types of methods that could be used to answer them. And then we'll turn it over to case studies after that.
Thank you, Bridget. So as Bridget mentioned, in the next few slides, I will highlight at a high level 6 approaches we've used to examine perceptions and offer some examples along the way. Some of these approaches may be some methods that you're familiar with, others may be methods that you're less familiar with. If along the way, you're interested in a study that we didn't provide enough information, please feel free to reach out to us offline. We can discuss those studies more and provide additional information. But one of the first steps in exploring consumer perceptions is to take stock of the existing evidence. Literature reviews allow us to summarize what we might already know, and that's the first research question. So what we might already know, where the gaps are, and ensures that any new work that we do builds on what has already been done. They are also valuable because they can identify validated survey items or measures that we can adapt for future studies and highlight methodological lessons as well. So for one of our projects, we worked with a federal client to strengthen their understanding around food allergy prevalence and labeling perceptions. For this client, we conducted 3 literature reviews, each with a different purpose. The first one focused on identifying robust data sources to more accurately estimate the prevalence of food allergies in the United States. The second literature review evaluated methods to enhance the surveillance systems. And then the third literature reviews explore consumer perceptions and understanding of food allergy labeling. And these literature reviews inform the client's future research priorities and regulatory consideration. In addition to literature reviews for the second research question, social media listening can also add value in understanding consumer perceptions, as it allows us to tap into ongoing organic conversations and see how people are talking about topics like ultra-processed foods, for instance. Social media listening can be used on its own to explore emerging themes of what consumers are discussing online, or can be combined with existing data to triangulate findings and deepen our understanding of consumer sentiment. So in another study, we leveraged social media listening to uncover consumer experiences with emerging food products, such as alternative meats and novel sweeteners, and including reports of adverse events around those. I don't want to go into too much details on this one because you'll hear more in the upcoming webinar about this particular study, but this work will show how social media listening can surface nuanced consumer perceptions using existing online conversations and information. In another project, this was for a commercial client, we used social media listening to analyze consumer reactions to competitors transitioning from artificial to natural food colorants. We also explored consumer knowledge, beliefs, attitudes surrounding natural colorants. And this type of analysis provide a rich understanding of consumer sentiment and behavior, helping stakeholders anticipate market responses, refine messaging, and make informed product or regulatory decisions. We can go to the next slide, Bridget. All right, so aside from literature reviews and social media listening, surveys are also a powerful tool that enable us to identify common beliefs, pinpoint misconceptions, and explore how these perceptions vary across different consumer groups. These insights can lay the groundwork for designing effective interventions. Now, if we want to move beyond simply observing what people think or identifying association, and instead maybe understand how specific communication strategies or certain policy elements can actively shape perceptions, attitude, or possibly guide behavior, then experiments are needed. With experiments, they allow us to test causal relationships by isolating the impact of specific components. For instance, different messaging framing or variation in labels or claims that we put on product packaging. While experiments don't necessarily explain why something works, they do provide strong evidence for what works and under what conditions. And so they're giving us confidence in the effectiveness of specific interventions or approaches and helping us make informed decisions about what to scale or what to refine. One of my colleagues and I conducted an experiment for a federal client to examine how different statements describing a drug risk severity in a TV prescription ad, such as referring to risks as severe or life-threatening, or referring to them as serious, or just saying that there are risks, and then following with a list of specific risks, influence consumer perceptions and their behavioral intentions. What we found was that the type of framing statement had a significant effect on perceived risk severity, on perceived utility of risk and benefit information, on fear of risks, and on perceived likelihood of explicit and implicit benefits. So this finding suggests that using this lead-in language that describes risk severity, particularly for products with severe or life-threatening risk, may better allow consumers to make judgment on risk severity than stating that a drug can have serious reactions or just simply that reactions are possible. We can go to the next slide. All right, so while consumer perception, like Bridget said, often guide behaviors, the relationship is not always straightforward. So for example, a shopper might perceive a product as less healthy, but at the same time still choose it due to taste, convenience, or price. Methods like discrete choice experiments, trade-off analysis, or virtual simulation tasks, possibly a virtual shopping task, can be useful in assessing the relationship between consumer perceptions and behaviors. because they create this realistic decision-making scenario where we can observe how consumers weigh competing product attributes and how their perception influence or are overridden by other priorities. In the last webinar, a few of my colleagues from RTI presented several case studies on discrete choices experiments that examine how consumers make choices when provided with different information on the label. To round out our approaches on that last research question, qualitative methods offer a valuable lens into the why behind consumer perceptions and behaviors, while surveys help us map beliefs and experiments test causal relationships. Qualitative approaches allow us to explore the underlying thought processes, emotion, contextual factors that shape those perceptions and decision-making. They help us assess the nuances that qualitative methods alone can fully capture. So as you can see from these slides, there are many tools to examine perceptions, and the right approach depends on the question at hand. We can go to the next slide, Bridget. So in the remaining time, Bridget and I will discuss 3 case studies involving different approaches to studying perceptions. In the first study, it's a measurement study to develop a set of validated items related to risk and benefit perceptions. The second case study is a mixed method study to assess how consumers understand and interpret terms commonly used in advertising. And the last case study is an experimental study that examined the effect of claims, graphic, and disclosure on consumer understanding and perceptions. I'll turn it over to you, Bridget.
Thank you, Mickey. So to start with the first case study, this is a study that we affectionately refer to as the Measure Study. It was funded by FDA several years ago. And the background is that for a few years, the staff in the Center for Drug Evaluation Research, specifically within the Office of Prescription Drug Promotion at FDA, had been conducting research looking at the effects of prescription drug advertising on perceptions of risks and benefits for drugs, and they weren't finding much. And they started to wonder whether the reason why they weren't finding any significant results is because they might have not been using the most effective measures. So in other words, the measures they were using were possibly not picking up on those differences in perceptions that could be produced by different types of elements in the advertising that they were interested in studying. So they contracted with RTI to conduct a 5-year study to develop and validate measures that could be used in future research. This was a mixed methods, multi-phase study, and I'm not going to talk with you about all the numbers in this study because there's some factor analysis and some pretty sophisticated statistical analyses that were used for each measure, and I feel like that probably wouldn't be the most interesting part for this audience or the most salient to the research that you're doing at this point to know about which prescription drug benefit or risk measures worked best. But what we will do is talk through the different methods that we used in each phase so that you can see the process that we use to develop measures. And I think those methods could be applied to just about any context. So the process that we went through in conducting this study, we wanted to first look at the landscape and say, okay, are there measures out there in the literature that we're unaware of that we haven't yet been using that might be able to help us answer some of our research questions, specifically related to perceptions of benefit and risk related to prescription drugs. So we conducted a pretty broad literature review, spent about 6 months doing that, looking in literatures on public health and communication, health communication, and tried to identify any existing measures and where the gaps in measurement really were. I think the result of that lit review, we found approximately 38 existing measures that we figured we could include in our study to try to validate against other potential items that would be developed. After the lit review, we moved on to some qualitative work where we put together 10 focus groups with prescription drug users for different illness conditions. And the goal there was to try to identify factors that influence drug decision-making and to understand how people think about, conceptualize risk, benefit, and efficacy, and what are the sort of sub-factors that we need to make sure that we're including and trying to measure as we try to to develop measures for each of these constructs. So then based on the results from the focus groups and the literature review, we put together an item pool of 97 measures. And those were existing measures from the lit review and new measures that we developed based on these major 4 categories that you see on the slide. So risk, benefit, efficacy, and this risk-benefit trade-off that people make when they're deciding about a prescription drug. So is the risk going to outweigh the benefit or not? And then once we had that item pool developed, we started down the road to trying to validate these measures, and obviously to try to streamline and get to a smaller number of items that would be used in future work. So we started with a technical expert panel. We recruited 5 experts in risk perception and scale development. I think they came to 2 presentations and virtual meetings and weighed in over email on a couple of different surveys and exercises with the intention of trying to evaluate the face validity of the items. So in other words, is each of these measures actually measuring what we think it's measuring? Does it seem to be, are we calling something an apple when it's an orange? And also we asked them to make suggestions about anything that we might be missing in our approach, or any elements of those constructs that they felt were not there that needed to be added. Once we had the technical expert input, we then moved on to testing qualitatively first with cognitive interviews. In 27 separate interviews, we looked at each of these measures to estimate things like, are they clear and easy to understand? Do we have all potential answer options represented? Are any of them double-barreled? Are they asking more than one thing? And any other unintended effects or consequences of the way that we were asking different measures. And so based on that cognitive interview data, we refined our measurement pool a bit more. And then we went into the main study where we used multiple rounds of iterative testing with survey participants, a total of 7,000 people over the course of all of our rounds, to do the statistical testing. And here we also built an experiment into this online survey. So we first tested with 2 illness populations, people with chronic pain and people with high blood pressure. We developed ads for a fictional drug for each of those 2 conditions, and we created versions of those ads. So we had some versions of the drug that were very high risk, high benefit. We had some versions that were low risk, low benefit, and every combination of those 2 constructs. So low risk, high benefit, etc. The idea there was, if our measures are good, then when people see a high risk version of the ad, they're going to have perceptions that the drug is high risk. And so we randomized people to receive different versions of the ads and then tested their perceptions after they had been exposed to the particular ads. We also measured reliability of the multi-item scales in this study. We employed factor analyses and other statistics, and then we also tested with a group of general population participants. After we had completed with the audiences that we felt were most salient, the people who had these 2 illness conditions, we wanted to see, what if we try these measures with people who don't have these conditions? Do we still see differences on perceptions in a general population audience? So does it have external validity? And so this not so pretty figure that I'm going to show you now is just quickly so you can get an idea of how we narrowed that pool of items over the course of each phase of the study. So we started with the 97. After the technical expert panel, we were down to 67 that were retained. After the cognitive interviews, down to 57, and then it goes on until we're left with a smaller number of items at the end. We ended up with 21 items that had pretty rigorous evidence for both reliability and multiple types of validity. These represented 11 different risk and efficacy constructs. So examples of that would be risk likelihood or benefit magnitude. How powerful, how strong is the benefit? And some of them were multi-item measures, but we also recognize that people would want to use them in survey research, where you often don't have a lot of landscape on a survey to ask a lot of questions or use multi-item scales. So we did also include the 12 items that perform the best as single item measures that could be used independently to measure some of these constructs. Some limitations worth mentioning for this study were the use of the online panel that we used through Knowledge Networks, now known as GfK, means likely missing coverage of certain types of participants in the US population, those with lower health literacy or lower general literacy. And so we strongly encourage this research be replicated in those populations. And then we also want to mention pricing information was not included in the ads, and that obviously likely has an important impact on people's perceptions of drugs and products. Obviously, it's also very complicated to try to include in these studies when it differs for different people depending on health insurance coverage and things like along those lines. So the conclusion of this study, these items have been used in several other research studies that have been collaborated upon with RTI and FDA since, and the results are published in the journal Research in Social and Administrative Pharmacy. So if anyone is interested in more details, we are always happy to share, and we will share contact information at the end for specific questions on that study. So moving on to case study number 2. This one was a different methodology. So in the second case study known as Terms and Phrases, again, this is funded by the Food and Drug Administration. And in this case, they really were interested in knowing for terms and phrases that are often or frequently used in direct-to-consumer advertising and the type of health detailing that pharmaceutical companies use with healthcare providers about drug products. Are the terms and phrases that are frequently used well understood by those two audiences? And do they have any implications for people's perceptions of the safety and efficacy or risk and efficacy of the drugs? They had a long list of terms that they wanted to test. And we designed a mixed method study here to try to look at these two primary research questions, which were really, how do consumers and healthcare providers understand and interpret these terms? How do they make meaning of them? And secondly, what do these terms imply about safety and efficacy of the drugs, if anything? So we had two main phases in this one. We conducted qualitative interviews with 60 individuals using a virtual interview where we were able to screen share to show them the terms and phrases online as opposed to just reading them aloud, and have them react to those terms and phrases. So this was a very open-ended interview. What do you think of when you see this word or this phrase? And then we followed that up with a quantitative phase, which was 1,069 consumers and 1,080 healthcare providers answering survey that got into more detail and actually used the responses to the qualitative interview to develop multiple choice questions. So these are just some of the terms that were included in that study and that we investigated. And you can see some of these overlap a bit with research that you might do in food, terms like new, pure, natural. Others are very specific to prescription drug advertising or detailing that happens with healthcare providers. As far as the sampling for the survey portion, we used a nationally representative sample. So a probability sample for each of these two populations. This was conducted during COVID. And so at the time, we were really trying to look at the literature on how to get good response rates for healthcare providers. And best practice at that point in time was using a mail survey because a lot of email invitations to providers were just being missed, filtered into spam, not responded to. So we used a mail survey for the primary care physicians, PCPs on this slide. And for the general population, we used a mail push to web, meaning they were invited by mail through ABS postal file to be nationally representative, and then received a link to complete the survey online. So the questions that we asked on this study were really very open-ended in the first phase, as I mentioned. Which of the following comes to mind about each of these drugs? Sorry, the open-ended phase, as I mentioned, was just what do you think of when you hear these terms or see these terms? And then in the survey portion, we used the responses to those to develop very specific answer options for questions about each term. And this is just an example for one about off-label, where you see all the different multiple choice options that people could choose. The second major set of questions that we asked for each and every term was, how safe do you think each of the following drugs is compared to other drugs for the same condition on a scale of 1 to 5, much less safe to much safer? And how effective do you think each of the following drugs is compared to other drugs for the same condition? And that's on a scale of 1 to 5, much less effective to much more effective. And remember that they have no other information about a drug. All it says is for a drug described as convenient, or a drug described as natural or powerful. And so the perceptions we're trying to measure here are purely based on these independent terms or phrases, just to get a sense of, do those phrases and terms alone, absent any other information, have any impact on people's perceptions of whether a drug is safe or effective? And so I'm not going to share the specific details of each of those terms and phrases in terms of which ones are perceived as most effective or safest, or these results are still making their way through FDA clearance, haven't gone through that process yet. But we did have some really meaningful results in this study. We did find that some of those terms and phrases did result in statistically significantly higher perceptions of risk and benefit, and significantly lower risk and benefit than the other terms in the pool. We also found that there were a number of terms, both for consumers and primary care providers, that they did not know what they meant, or that they did not have a good understanding of, or not able to describe in an open-ended way, or answered inaccurately in the multiple choice questions. And then we also found that there were some terms that suggested guarantee of efficacy or even cure. And those were things that obviously would be important for FDA to know as they make decisions about how best to regulate this type of prescription drug promotion, and create guidance about types of terms and phrases that can be used in that type of promotion and advertising moving forward. So with that, I'm going to turn it over to Mickey to talk about case study number 3.
Thank you, Bridget. Yeah, so in our third case study, we explored how both consumers and healthcare providers interpreted the term targeted in the context of a targeted treatment, also in a prescription drug promotion material. Early findings from focus groups showed a tendency for consumers to associate claims that a treatment is targeted with greater drug efficacy and effectiveness, and with fewer risks, even when those claims weren't backed by clinical evidence. So this raised an important question about how language can inflate consumer or healthcare provider perceptions. So in the study, you can go to the first slide, next slide, Bridget. So in the studies, we looked at how 3 elements, that is a claim, a graphic, and the graphic could be either accurate or misleading, and I'll describe what that meant, and a disclosure impacted understanding of how a drug that is a targeted treatment works, and kind of the perceptions associated with that. And so our main research questions are listed on this slide. And I wanted to mention that while this study focused on prescription drugs, the implication extend well beyond pharmaceuticals. So similar dynamics are at play in food or tobacco or other health contexts, where claims like Bridget said, like natural or fortified or immune boosting, along with graphics and disclosure, can significantly influence how consumers perceive a product's helpfulness, safety, or value. We can go to the next slide. So before I go into the methods for this study, I wanted to mention that before we launched the experimental phase, we took several important steps to ground our approach in evidence and realism. First, we conducted a literature review to understand what has already been done around the use of claims that implied or that mentioned targeted treatment. And this helped us identify gaps, refine our research questions, and also identify some possible items. Next, we carried out a marketplace evaluation of prescription drug ads and promotional websites, reviewing over 400 materials. We looked at how claims about targeted treatment were being used and what they communicated, what types of graphics accompanied these claims, and what might constitute a misleading graphic. Importantly, we weren't trying to create a blatantly false graphic, giving that kind of information, because in reality, such materials were likely going to be flagged by FDA and removed. Instead, we focused on what were the subtle forms of misleading communication, particularly those that misled by omission. We also, during this marketplace review, we also reviewed the type of disclosures that were used to contextualize the targeted treatment claims. And what we landed on was a disclosure that was clear and direct, and that noted that healthy cells are also going to be harmed by this targeted treatment. But there are other disclosures that we found that were more vague. For instance, some of them said that the way the drug works is not fully understood, and that was the sole disclosure that they offered. So to ensure, additionally, to ensure our graphics were realistic and ethically sound, we collaborated with a health communication and visual design expert to avoid unintended consequences in how the visuals might be interpreted. So once this foundational work was complete, then we developed the stimuli and conducted cognitive testing and pre-testing to test both the survey items and the stimuli that we developed. This layered approach ensured that our study was methodologically rigorous, but grounded in the real world context of how consumers encounter and interpret drug information. So for the main study, we recruited adult consumers from the general population and healthcare providers who prescribe medicine, and we randomized them to the study conditions. And as you can see, the design is listed in that table, so participants could be randomized to receiving a claim and a disclosure without a graphic, or receiving a claim with a graphic, or a claim, a graphic, and an accurate graphic and a disclosure. So they were randomized to one of the conditions. And the survey included comprehension items and validated benefit and risk perception items. And these items were the ones that Bridget described earlier. And also we had behavioral intentions. We can go to the next slide. So this slide shows the stimuli that we use. These are just elements that we extracted. So we extracted the claim and the graphic and the disclosure for this presentation, but these elements were integrated within a prescription drug website that was very realistic, and our cognitive interviews indicated that there was no difference between our stimuli and other prescription drug websites that consumers have seen in the marketplace. And what I wanted to point was that the claim was different based on the population. So we had one that was consumer friendly, the top one for the consumer that the consumer saw, and this was again based on the marketplace review. And then the bottom one was was more technical and was for the healthcare providers. The graphics and disclosure were identical for the two groups. The graphic showed 3 elements of how the drug works. The first panel showed that the drug attaches to a protein on the cell. The middle panel indicates that the drug goes inside the cell. And then the third panel shows that cell death occurs. And so on that last panel, on the third panel, the top graphic is the accurate one and the bottom one is the misleading one. And what the top graphic shows is that the healthy cell is not just this targeted drug doesn't just affect the cancer cells, but it can also affect the healthy cells. While the bottom graphic that's misleading only shows that cancer cells are being affected. And at the bottom is the disclosure that we included, and the disclosure was meant to provide that additional context that healthy cells could also be affected. We can go to the next slide. So I'm going to present the results up front, and then we can go through a couple of charts to discuss them in more detail. So what we found was that most consumers and healthcare providers recalled the claim and the disclosure. We also found that the presence of the graphic had a consistent effect on understanding of how the drug works. So those viewing the accurate and the misleading graphic were more likely to mention the three elements in the graphics: that the drug targets a protein in the cell, that it goes inside a cell, and that it kills the cell. The disclosure also had function as intended and addressed the drug's potential to harm healthy cells. We did not observe a combined influence of disclosure and graphic, suggesting that the effectiveness of the disclosure was uniform across the two graphic types. And finally, we didn't observe an impact on perception either until we conducted a moderation analysis based on consumers' health literacy. So we can go to the next slide and look at the results. All right, so this set of outcomes focuses on how well participants understood those three elements of the graphics: that the cell attaches to a protein, that it goes inside the cell, and that cell occurs. So what we found was quite interesting in that both the accurate and the misleading graphic improved understanding of these elements compared to the condition that didn't have a graphic or that had just a disclosure or had the claim. In our case, the key difference between the accurate and misleading version wasn't whether the cells would die to, in terms of that third panel, but which cell dies. So the subtle difference may explain why maybe we didn't see a difference between these two graphic conditions. We can go to the next slide. And these results were among the ones on the previous slide were among consumers, and these on this slide are among healthcare providers. And we see the same exact pattern with them. The accurate and misleading graphics, they improve comprehension. We can go to the next slide. So in addition to those comprehension items, we also looked at a different set of outcomes, those that were more implicit or derived from information presented rather than explicitly stated. So things like lateral, this drug only attaches to cancer cell, or that it does not harm healthy cells. So this measure helped us assess how participants were interpreting and internalizing the information. And it was important because it reflected how consumers often make sense of this complex information. So one of our key findings was that from our study was that the disclosure worked as intended, as I mentioned. So as you see on this slide, when the disclosure was present, consumers were significantly more likely to correctly understand that even though the drug was described as a targeted therapy, it could still harm healthy cells. Those who saw the disclosure understood that the drug doesn't exclusively attach to a cancer cell, but rather any cell that has that specific protein. And we can go to the next slide. And we found the same exact patterns among healthcare providers as well. The disclosure worked as intended, increasing understanding. We can go to the next slide. All right, so the claim, as I mentioned, the claim, disclosure, and graphic had little to no direct effect on risk or benefit perceptions, attitudes, or behavioral intentions. However, some of the effects on perception emerge when we assess moderators such as consumers' health literacy. And so these two charts show that drug perceptions at 3 different levels of health literacy. The middle line, the blue line, is average health literacy. The teal line on top is the is one standard deviation below average literacy, and then the purple line at the bottom is the one standard deviation above average health literacy. And so what we found was that at the higher level of self-reported health literacy, the presence of the disclosure lowered perceived benefits of the drug, resulted in lower perceived benefits and also higher perceived comparative risk. And what that means is that they reported less agreement that the drug is less likely to harm the healthy cells. We can go to the next slide. We found a similar pattern here with additional perception. So the presence among those with high literacy, the presence of the disclosure lowered comparing safety scores. That is, they had less agreement that the drug was safer, and also resulted in lower intention to talk to others about the drug. And we can go to the next slide. And then finally, also at high level of self-reported health literacy, the presence of the disclosure resulted in lower intention to take the drug. So ultimately, the disclosure impacted perceptions of benefit and risk, but primarily among consumers with higher health literacy. Those with lower health literacy didn't show the same shift, suggesting that they may not have fully integrated the disclosure information. This highlights a key challenge that critical health information, especially when it involves complex concepts, may not be equally accessible or influential across different audiences. And with that, I would like to conclude by acknowledging our colleagues from FDA in the Office of Prescription Drug Promotion, Center for Drug Evaluation and Research, who funded and conceived some of the studies we discussed. And I'll turn it over to Caitlin.
Thank you. Great presentation. I think it's fascinating getting into trying to measure human behavior. So really great job on sharing those case studies with us. I'm going to have Bridget, you go ahead and stop sharing so I can put up our Q&A slide real quick, and then we'll jump into these questions here. All right. So we have a question here talking about the recruiting process. So can you guys talk more about what that recruiting participants looks like? Is there a screening process? And then there's a question here also about strategies to help reducing bias when studying consumer perceptions across different cultures and demographics. So can you kind of walk us through recruiting participants for these studies?
Sure. Mickey, I can start with that. And then if you want to jump in on anything that I leave out, please feel free. So really it would depend on the target audience for the study. We talked about a number of different studies in this presentation. I think in some of these studies, we've used audiences for whom oncology drugs would be very salient. So that is obviously a very different type of recruiting than if we're looking for general population consumers. Sometimes if we're just going for qualitative research with general population, we might use a recruiting firm that has the ability to contact participants for us. In the past, we have also used social media for recruiting online if we're looking for a specific type of population. In some of the adolescent studies that have been done, the social media recruiting has been very effective. But we also do use web panels. And then in the one study that I mentioned, the nationally representative sample, we use an address-based list that RTI has internally, where we can draw a random sample of the national population in order to make sure that that is representative. In cases where we would want to oversample particular populations, for example, Mickey mentioned health literacy as being an important factor. For example, if we were looking at a study where we wanted to understand more about the lower health literacy audience, we might try to oversample that population. And so we can do that using existing web panels where they have a pre-existing measure of health literacy and try to start from that as a place for recruiting to oversample the specific populations. I'm not sure if that answers the question, but Mickey,
I think it gave a lot.
Yeah, and I can add about, we did have a screener, I think for all of us, all of our studies, we had a screener for the last case study. We asked healthcare providers if they prescribe medicine, for consumers, we, as part of the survey, we didn't use a panel that had the health literacy items. We asked them as part of the survey. And we also asked them about, in the screener, about their experience with cancer treatments. So we tried to get some information in the screener for the participants.
Okay, very helpful. There's a question here about perceptions and how quickly they can change. I think that was mentioned a little bit in the talk. So that given that perceptions can change quickly, how long are initial assessments valid? And then is there a way to perhaps quickly reassess to see if perceptions have changed? Is there a less intense investigation to see if those initial assessments are still valid?
Yeah, this is a great question, and one Brian might want to jump in on, because I think I would probably quote him in saying that perceptions can be ephemeral, meaning that we do see that they change over time and often quickly in response to the information environment, right? So Brian has done a number of studies where he looks at linking perceptions to specific events in the media and being able to link those. And so that obviously would require looking at perceptions over time at multiple points in time. And we've done that with social media listening and other methods. You could do it with repeated cross-sectional surveys and different methods like that. But I think it's an excellent point. Brian, is there something you would want to?
No, well, yeah, just to note that, yeah, it is a great, insight. Doing that kind of work over time is, can be resource intensive, but there are creative ways to do that. And even within this portfolio of work, we've had some of the studies, not in the studies we're talking about here today, but in others where we followed up with folks 6 months later, in other instances, as well. And so I think tracking perceptions longitudinally can be really important. Recognizing the context in which people are engaging with the material can be important as well. But one side note, speaking of time, I know we're almost out of it here, but I'll just note that one of the things that was really compelling in pulling this presentation together for you all, these are a couple of hundreds of studies that we've had the privilege of publishing in this space. There's really quite a bit of work, and some of it's very nuanced. We'd love to talk further with folks, so please seek us out on LinkedIn and other places to follow up for additional discussions about future collaboration or questions you might have about some of this. But Caitlin, I'll turn it back to you.
Yeah, absolutely. There's a million questions here I want to ask, and we are a little short on time, so I think we have time for one more question. But one of the case studies that you mentioned, that perceptions didn't necessarily match the behavior. Can you talk, is that always the case, or is there situations where that behavior and perception is more aligned?
I'm not sure which one that's specifically referencing, but I think it can be hard to study behavior sometimes, depending on the type of methods that you have access to and feasibility there. So we obviously want to try to get as close to behavior as we can. We use health behavior theory to help us in thinking about what might come before behavior, behavioral intentions or attitudes or whatever those predisposing constructs might be. And so measuring behavioral intentions can be an important part of the work to see, well, someone might have an attitude or a perception about a drug, but does that actually translate to behavioral intention and then subsequently the actual behavior? And so you can measure behavioral intention, and in some cases we can measure behavior. A good example of that is in the tobacco cessation studies, where you can look at calls to the quit line. That's a behavior. Are people actually calling after seeing ads? And so when you can measure behavior, that can be really important. Sometimes they might not line up because there may be other things, other important constructs like self-efficacy. A person can have specific perceptions, but if they don't feel that they can confidently do the behavior, then that can be a barrier. And there are obviously other barriers.
And I'll also just note, add on to this, that the person asking the question and others might be interested in connections between this discussion and our first seminar, which Sherry Cates and Dallas Wood also talked a little bit about measuring behavior and some of the challenges there as well. So that might also be of interest.
Okay, I'm going to utilize, we have time for one more question. I'm going to sneak it in. So once these perceptions are measured, how can researchers and organizations effectively translate those findings into perhaps better communications or education strategies? Feels like a good note to end on.
Yeah, that's a great question. Who wants to take this one? I can talk to it, but Brian probably has a really good high level answer because he knows a lot of different parts of our
Bring us home, Brian.
Sure. Well, I'll just say this that question, the spirit of that question, is partly why we're here today, to talk with you all about those opportunities. There is a tremendous amount of research that's sitting in peer-reviewed literature right now. We need to translate more of it into action, and that's something that we try to engage in quite a bit, at RTI, but there are different opportunities. There are opportunities to both think about, direct implications. There are opportunities to think about, audiences that have or haven't been reached. There are opportunities to think about, both changing the way that we're talking about things, but also introducing new ways to present information to make it more accessible. Sometimes it's a matter of exposure. Sometimes it's a matter of looking at the way that information, spreads over time. And there's a lot of work there to be done, and that's the spirit of what we're hoping to do in the next stage of our work. And if you've got ideas about that, reach out to us. That'd be great.
Perfect. Thanks for bringing us home. I do want to, before we close, I know we're at the top of the hour here, just to note that last webinar in this series is going to be on October 28th, focused on helping consumers navigate information environments. So you can register for that at IFINS. Other than that, we are out of time, and I want to thank our speakers again. This was a fantastic webinar. Thanks, everyone.